Hi everyone, happy Women Wednesday. Hope you're doing well and enjoying the pretty warm day that we're having here in the DMV. Today we're going to be talking about monkeypox and harm reduction, so just ways to keep safe and acknowledging the behaviors and events that people will still engage in and go to during monkeypox or during this current monkeypox outbreak or increase in cases and whatnot. Just making sure that you have some tools and resources and knowledge in your tool belt to help you make informed decisions about how you want to engage with the public. We've got Whitman-Walker in the room, so I'll just get them on stage and we'll get started momentarily. Hello, Whitman-Walker. Hey, Paul. Cool. So, during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's community health team. And today we're going to discuss monkeypox and harm reduction. But first, let's give some definitions. So what is harm reduction? The National Harm Reduction Coalition defines harm reduction as a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief in and respect for the rights of people who use drugs. However, in recent years, the public health field has also embraced the practice of harm reduction by providing communities with resources and tips that acknowledge the various behaviors people will engage in regardless of health risk or things that might happen to your health if you still engage in these behaviors. And so this application of harm reduction in public health really aims to help people make better decisions to protect their health even when they're engaging in certain behaviors that could put their health at further harm. So think if someone's still going to engage in condomless sex or barrier-free sex, then we want to make sure you know where you can go and get tested and access HIV and STI testing. Or we want to make sure that you know about HIV prevention resources like PrEP and PEP, PrEP is a daily pill that prevents HIV, kind of like your birth control for HIV, but it prevents HIV instead of pregnancy. And then it's also PEP, or post-exposure prophylaxis, is like your plan B for HIV. So instead of preventing pregnancy after you think that you might become pregnant within 72 hours, you have to take this other pill or regimen of a pill that takes 28 days to take, and you take that within 72 hours after having an exposure to HIV, and then you should have a really high chance of staying HIV negative. So those are just some of the ways that we try to apply harm reduction in public health today. So now, what's monkeypox? Or mpox. This is usually a self-limited disease that lasts 2 to 4 weeks, and it typically presents with a fever, rash, swollen lymph nodes, chills, exhaustion, muscle aches and back aches, headaches, a rash that can look like pimples or blisters that appear on the face, inside the mouth, and other parts of the body, like the hands, feet, chest, genitals, anus, and it may lead to a range of medical complications. How's monkeypox transmitted? It's usually transferred by close physical contact, so like skin to skin contact is pretty common. And then monkeypox is also transmitted from one person to another by contact with lesions. So if they're actively going through monkeypox and they have open lesions on their body, you want to avoid those. Can also be transmitted through bodily fluids and respiratory droplets and other contaminated materials like bedding or sheets or clothing. So just avoid contact with those. And that said, what are harm reducing and preventive steps that you can take to keep yourself safe and protected during this time? So currently a monkeypox vaccine does exist, but vaccines have not been largely available even to people who are identified as high risk for monkeypox or mpox. So you want to check your state and local health departments and county health departments websites for the latest information about their availability of monkeypox vaccines and how to pre-register for an appointment. If you're looking to be vaccinated against mpox while you wait for a vaccine appointment, you can also practice the following preventive strategies. So avoid close skin-to-skin contact with people who have a rash that looks like monkeypox or mpox. Avoid and do not handle, touch the bedding, towels, or clothing of a person who currently has monkeypox. And then you also want to wash your hands with soap and water often, or use an alcohol-based hand sanitizer for at least 20 seconds. Now here are a handful of preventative strategies for your sexual health, and be mindful that your environment be mindful of your environment and just identify any potential risk factors for transmission while you're there. So, for example, if you're at a sex party or another enclosed space like a circuit party or a cruise club or a bathhouse or sauna that requires minimal clothing, there might be a much higher chance of you contracting mpox or monkeypox in that space. So just be aware. Also, shout out to AIDS United for this blog post where a lot of this information is coming from in terms of preventative strategies for sexual health. So if you or a partner has monkeypox, the best way to protect yourself and others is to avoid sex of any kind and avoid kissing or touching each other's bodies while you are sick, and especially avoid touching any of the rash. You also want to avoid kissing or touching the rash during sex, as touching the rash can spread it to other parts of the body and may delay your healing process. Remember to wash your hands, sex toys, and any fabrics like beddings, towels, or clothing before use and after having sex as well. And it also may seem a little bit out of place, but wearing clothes during sex can help reduce the chance of transmitting monkeypox to an individual. If lesions are present in the genital areas, you want to use protective barriers to reduce your risk of transmission, so like dental dams, condoms, or saran wrap if appropriate. Another safe way to engage in sex during this time is by masturbating. So masturbating, preferably at a 6 foot distance with your partner, can be an effective way to reduce transmission risk and is always one of the safest ways to engage in sex. Alternatively, you can try methods of sexual intercourse like virtual sex or phone sex, again, because these keep you away from another body. And then finally, you can limit or reduce the amount of people that you are engaging in sex with, especially in one setting. So again, kind of avoiding any large group sex parties or bathhouses or situations where there's going to be a lot of people having sex at the same time or sex together. Now, here are a few considerations for people who are in the sex trade or who their profession is a sex worker. So again, please note that depending on the circumstance or setting, some sex workers will be able to decrease their risk of transmission more often than others. And if you are doing in-person services, it is vital that you are clear about your boundaries with your clients and avoid accepting clients who are experiencing any rashes, fever, or other flu-like symptoms. Additionally, try to avoid kissing, cuddling, hugging, or massaging your client if possible. If you are able to do any of the following, this will help decrease the likelihood of contracting monkeypox. So you want to examine your clients for unusual scars, lesions, or rashes, especially on the hands and face. You want to avoid brushing your teeth before or after seeing clients, as this can cause small cuts in your gum and increase your risk of transmission. And outside of monkeypox, it's always good to not floss or brush your teeth 30 minutes before you engage in sexual activity, because then you can create open wounds in your mouth where STIs can be transmitted through that way. You also want to use a towel or a top sheet on the bed and be sure to change sheets in between clients. You want to wash your bedding, towels, and sheets on high heat, preferably between client visits. You want to check in with regular clients to see if you can upcharge in-person services for nudes, sexting, or camming. And you want to also use condoms or dental dams or other barriers when performing sexual intercourse or oral sex like fellatio, analingus, or cunnilingus on your clients and vice versa. So that was a little bit of information on some harm reduction strategies they can use during this time of monkeypox. Now, according to the CDC, we have a lot of cases of monkeypox happening in the US and also just around the world. But in DC, you can pre-register for a monkeypox vaccine appointment on the DC Health website. And you're currently eligible to be vaccinated in DC if you are a District of Columbia resident who's 18 years or older and you are you can be of any sexuality, but especially for folks who are engaging with sex with men who have sex with men, or engaging with sex with people who identify as gay or bisexual men. Also, if you are a transgender woman or a non-binary person, or a person who is assigned male at birth who has sex with men, or if you're a sex worker of any sex or a staff member of any sex at an establishment where sexual activity occurs. So think again, bathhouses, saunas, and sex clubs. You are all eligible to get vaccinated for monkeypox. And also if you work in the state of DC, I believe you're also eligible. You will have to prove that you are a DC resident. So just use your DC identification card, so your license or your ID that shows your DC address on it. You can also use a utility bill or other mail with your name and a DC address, or a current DC lease or mortgage with your name on it. Thank you all for taking a little bit of time to learn more about monkeypox and harm reduction and how you can keep yourself safe while you wait for a vaccine if you're trying to be vaccinated. Be safe out there and just be mindful of rashes on folks and trying to not come in contact with those rashes or any bedding that they might have touched or clothing that they might have touched. As we are still in another public health pandemic, before we go, we want to give you a few reminders about the COVID-19 vaccines. If you've already been vaccinated, that's amazing. You've taken a really important step to preventing yourself and your loved ones and your communities from getting sick. Multiple variants have soared across the world, and it's totally understandable if you want to keep wearing your mask when you're outside or if you're in really tight spaces, as the vaccine isn't 100% effective at preventing new cases of COVID-19. As we've seen, COVID cases continue to have surges and downfalls and so on. So that said, the vaccine is not completely effective at preventing new cases, but it is very effective at making sure that you don't get very sick with COVID, that you stay out of the hospital with COVID, and that you don't die from COVID-related complications. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. You can call us at 202-207-2480. Again, that's 202-207-2480 to make an appointment. And if you're having trouble making an appointment with us, you can use the following resources. So for DC residents, you can visit vaccinate.dc.gov or call 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. Now, if you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with those people who are around you. But be mindful of masks and keep your distance, especially when you don't know whether a person has been vaccinated or not. Thank you all so much again for sharing the space and time and learning more about public health and harm reduction and monkeypox. And please follow our Whitman-Walker accounts at Whitman-Walker on Instagram, Facebook, and Twitter. You can keep up with our latest service updates at www.whitman-walker.org and follow our family accounts at RealTalkDC_ and at NoFilterDC. Have a great rest of your Wednesday and wishing you a great rest of your week. Bye.